So I want to geek out on this story for a minute. It's the morning, the night shift is over, there's the sun rising as it does every day when I get off at 7 a.m. It's like 7:30 or 8 right now. I had a young female, 20s or 30s, who came in. She had been diagnosed with valley fever, which is a fungal infection in the lungs. Coccidiomycosis is the name of the fungus. And she had this complication where she had fluid around her heart. I'm going to show you the echocardiogram of what that looked like. And the fluid was followed. She was in the hospital. It got better, got a little bit better than she was discharged home. And she got some chest pain and shortness of breath and came back this morning, and she had that fluid again. Now, what happened was it got really scary for a minute because she came in, she looked okay, and then all of a sudden, she lost consciousness. She got really sweaty, like out of nowhere, just sweat, like dripping down her face and her arm and her chest, everywhere. She was totally out of it. You know, I take her pulse, really thready pulse, slow in the 40s. Her blood pressure drops to 45 over whatever. Basically what happens when there's too much fluid around the heart, it can kind of squeeze the heart and the heart can't get blood out. That's called cardiac tamponade. It's a form of shock, of cardiogenic shock, where the heart is not pumping out enough blood. Luckily, we gave her, she had been vomiting, so she didn't have enough fluid in her body. So we gave her fluid. She perked up, woke up, the sweating went away, her heart rate, her blood pressure got better. But at first I thought that was really interesting. I was trying to explain it away as, oh, she's just dehydrated. But if she was just dehydrated, her blood pressure went down, her heart rate would have gone up to compensate. And I noticed that, and I was like, that doesn't make sense. So I got the I got the ultrasound out and took a look at her heart. And I'm going to walk you through the really interesting, just some anatomy of the heart. And I want to show you the ventricles and the atrium and the lining around the heart, which is called the pericardium, and how when that gets fluid in it, it can be very, very dangerous. She survived. She did fine. We saved her, but that was pretty scary for a little bit in there. I'm not gonna lie, it scared me because I wasn't exactly sure. You know, you're kind of figuring out what's going on, but we were able to kind of quickly diagnose it and take care of her. So take a look at this echocardiogram, learn some heart anatomy. I think it's kind of fun. Personally, you know, it's always good for me to learn more about ultrasound and how to use it in emergent situations where, gosh, like how many cases like this am I going to see in my career? A few, handful, not like 100, you know? So I think it's kind of stressful, but trying to do your best and be prepared and studying those cases so that when they come up, you know, you're ready for it and you can do something about it. I think that's what the preparation is ultimately about, and it never ends, you know? It never ends, the studying and all this stuff. I'm gonna cut this off because I don't want, what are they doing? Hey. Time to go home? All right, yeah. That was quite a night. I think the point of this is that, you know, this moment is inspiring me to be like, this is why you got to study and be on it, and it makes me want to learn more. I mean, I've been out of residency 10 years. I feel competent in what I do. I think I'm a good doctor, but then there's cases like this that come by and I'm like, man, am I good enough? Like, I need to keep studying. I need to get better at ultrasound. I need to think these things through. Like, I need to review these cases, and you know, they're so rare. They're one in a whatever, but it's being prepared for that moment when it matters, you know? It never ends. We can always get better. So I'm definitely going to review this one more, sharpen those ultrasound, those bedside ultrasound skills, review pericardial effusion, tamponade. What would I have done if I had to stick a needle in there and you know, drain the fluid around her heart, you know? But review that procedure. I mean, that's crazy to think that you might have to do that in it, but there are scenarios where if that's what you got to do, that's what you got to do. So just reflecting on that, enjoy that ultrasound. I hope you learned something from that, and just especially for those of us in the medical field, kind of inspired to be our best and always keep getting better. So this is a real basic. This is the heart.
Yeah.
Right atrium, left ventricle, right ventricle. And this is the pericardium right here that goes around it. Right there, we got a little bit of fluid, a pericardial effusion.
Big breath in, big one.
That's what we're talking about today.
And that's what you want to see. See it right there when she takes a deep breath.
See what?
The right atrium, see how it's collapsing just a little bit.
So we're checking to see if there's
and breathe.
That fluid is complicating the function of her heart.
That black right there should be like a thick hair. That's it.
Yeah, so that's a significant amount of fluid
so
there
that's moderate,
around
but I don't
the heart.
consider it severe.
That's what we're looking at. Okay, good.